Well, we are just getting started on this Friday after the break. We are so excited to introduce you to Dr. Andrew of Dorough Chiropractic. There he is in the neighborly green room. We are going to talk to him about birth trauma and chiropractic care for babies. That's coming up next. Stay with us. Welcome back to Great Day St. Louis. Here's a little piece of trivia, something that I was not aware of. In some countries, this week is Birth Trauma Awareness Week, which is a scary sounding deal. It is not here in the U.S. yet, but one local doctor is working to change that. And he's with us here today. Dr. Andrew Dorough is a chiropractor with Dorough Chiropractic in O'Fallon, Missouri, specializing in infants who have experienced birth trauma and even educates other healthcare providers around the world. Now get this, over the past decade, he has cared for more than 3,000 infants right here in the St. Louis area. And Dr. Dorough, thank you so much for being here today.
Thanks for having me.
Who knew that there was a birth trauma day across the globe? Exactly when we say that, because it sounds scary, what is birth trauma?
Birth trauma, for the sake of the infant for today, is just any kind of bodily injury or harm that's sustained to the infant from the birth process.
Are we talking about just the forceps maybe, or is that just one of many things that can happen?
That's one of many things. Normally when we think of trauma, we think of the scary, obvious things.
Yeah.
Maybe it's a broken bone, a severe hemorrhage, or an injured nerve. But the less severe are the ones that I'm finding that be a little bit more concerning to look for. They're under-assessed and underdiagnosed. And it's the mild and moderate situations in the infant that has an injury that we should look for. And those still can have negative long-term health consequences.
Well, I was going to ask you, it does sound so scary. What are some of the signs that parents and caregivers too, and you could alert your caregiver to this kind of thing?
I thought you never asked. So starting with the pregnancy, we want to make sure that if there was a breech pregnancy, how the baby bakes inside and how the birth process can dictate injury. So in labor and delivery, we wanted to see if there's a long pushing phase. Was the mom pushing for more than an hour or two?
Ow, yeah.
Yeah, long pushing phase, a lot of energy. Was there a vacuum or forceps or hand-assisted delivery? Tugging or pulling on the infant's head and neck can cause injury of the spine. Was there emergency cesarean section? Was there a shoulder dystocia, or was the child stuck in the birth canal? These are all indicators in labor. But if you switch gears to the baby, there are physical signs we can teach providers or parents to look for. So general shape of the baby, are they always in a curve? Do they have a head tilt or a twist? This is called torticollis. They have a favorite side to look at. You want to look at their face and their symmetry. Are their eyes in the right alignment? Are their ears in the right alignment? Is their jaw tilted? Is there a head shape issue? Those are physical things you can look for. Right after the birth could be facial bruising or even like feeding difficulties from the head and neck, and maybe even colic symptoms could be associated.
Some of this is pretty subtle.
It can be subtle, it can be obvious.
Well, it could be obvious, but I mean, even the subtle things, we would probably just pass them, oh, that's just, that just happens. It'll straighten out or whatever else.
Right, and it doesn't usually, so paying attention and just looking intently to see these things, it'll start to become obvious, and then what my concern is the deeper things underneath that.
Yeah, and I was just going to ask you, this came to me, if you don't mind.
Sure.
Is a kind of a preventative thing that maybe if a parent says, I think everything's fine, but knowing that could happen, would it be a good idea to bring the infant in and just say, just look her over or him over?
It should be a newborn wellness spinal screening. It's very, I always say an ounce of prevention is worth a pound of a cure.
Sure.
So the sooner you catch it, the better prognosis, the outcome down the road. It's easier to fix for the parent and the provider.
Anybody who's ever been through a child with scoliosis can tell you the earlier you can catch it, the better you can clear things up down the road.
Correct.
It can be a lot less traumatic to the child too if you get early. Of course, the big question that people are going to have is chiropractic care safe for babies?
I'm glad you asked this. If it's done correctly, yes. Chiropractors, when they're specifically trained and certified in this kind of work, there's no twisting, popping, or cracking associated with these kinds of care. So if I can just borrow your hand for a second, Ken.
Please.
Make a fist. Let's say this is the baby's head. I'm just going to gently hold it and just give a slight wiggle and a pressure on the affected tissue.
It's nothing. It's nothing.
It's barely anything. We hold it for a long time, and what we do is we're increasing blood flow to the injured tissue, decompressing nerves so the body can heal itself. So the amount of pressure I would use is the same amount of pressure you would put on your eye to put a contact in or to test the ripeness of a tomato. So very gentle, very safe and effective.
And plus there's just visible things that you would pick up on that a parent or a caregiver might not, right? I mean, we look at our babies and all we see is just beautiful, beautiful babies.
Yeah, exactly. And that's great. They're all beautiful little blessings, but it would not hurt to just at least assess and evaluate.
Hey, he has very caring, healing hands, too. My hand feels better already. Is that inappropriate? I hope not. You can find Dorough Chiropractic in O'Fallon, Missouri. To book an appointment, call them at 636-266-2000, 636-266-2000, or online at DoroughChiropractic.com.
Yeah, I mean, it just makes me run through the list of struggles, right, that we experienced in those newborn weeks, and makes me wonder, like, could that have helped?
Something down the road.
Yes, yeah, very informative. Thank you so much for sharing that.